All right, good evening, everyone, and welcome to our second podcast episode. I'm Alexander Kimbrough, your host. Each episode will be interviewing a passion professional who works in public health and healthcare. Whether you're a student, an early career professional, or a veteran in the field, after every interview, you have learned something new about public health and the warriors who fight the good fight every day. Tonight, we have the student Charles Holloway, a senior in biology at Alcorn State in Mississippi, and Dr. Karriem S. Watson, Chief Engagement Officer of the All of Us Research Program at the National Institute of Health. Welcome to you both, and welcome to the podcast.
Thank you. Great. It's good to be here.
Quickly before we start, this podcast is funded by AHEC, the Area Health Education Centers Program. AHEC is a federally funded program established to improve the supply, distribution, retention, and quality of primary care and other health practitioners in medically underserved areas. AHEC provides support services for information, dissemination on healthcare issues, and participants in collaborative community-based research. So, with that out of the way, we're going to start. With our AHEC student, Mr. Charles Holloway. So, Charles, tell us about your research. Tell us about yourself and your path to finding out about AHEC.
All right. Charles Holloway. I just recently turned 24 on the 4th of January. Currently, like you said, I'm a senior at Alcorn State University. I have a real good passion for science, and medicine. What led me through this program is through one of my previous teachers, Miss Sharonda Kimbrough. She was a big guidance for me. AHEC has also proven to be more of a, how shall I put it? It can become like a useful guidance tool to help me understand exactly as far as exactly what I want to do, and besides in public health or actually study MD medical medicine. Um, I plan on becoming a physician assistant. I recently just applied to Rush University for their master's program there. Uh, Much of a pretty brilliant guy, but that's a little bit about me. Yeah.
Yeah. So, how did you find out about the AHEC, the Area Health Education Centers Program?
So, like I said, my teacher,
Oh yeah.
Sharonda Kimbrough.
Cool.
Sharonda Kimbrough. She proved very useful, and actually with this guy for me, actually introduced me to the program. She actually allowed me the program. I'm getting a little tongue tied here. My apologies.
No problem.
Yeah, she really just introduced me to the program. Off rip, I was talking to her about trying to find careers in medicine, without really going to the full, through the whole medical school process. So she introduced me to this as a way to help me guide through that.
So, how's your experience been? What's the most enriching part that you've had since you've been involved with AHEC?
I want to say the certifications have probably been been the best program of the best part of the program.
Mhm.
It gives me a lot of insight, exactly, with dealing with different scenarios and different parts of the program. Being able to really interact more with peers who probably are in the same field as me, a chance to be, a lot of different aspects, really, yeah.
Yeah, can you talk about some of the certifications that were available, that were offered, that you actually were took up on?
One was the mental health one, which I found more interesting. I actually found more proven to be useful in my personal life. That certification, it helped me understand more of how a person's mental illness can affect them and others around them, and actually coping methods and mechanisms how to deal with it, and actually knowing how to spot them in your actually everyday life.
Yeah, that's really important. So, outside of the trainings, what else have you participated in when it comes to AHEC?
Um, far as my outside life, really, I wouldn't say much. Well, it actually pushed me to join another program here at my university. It's called ASU Heroes, Heros. I know it's not how you spell heroes, but the purpose of that program there is to actually help young students, African American, Caucasian, to understand your own sexual health. I feel like that program there, and it ties in with AHEC. It helps both. I feel like it coincides with one another to actually understanding, different aspects of, everyday, let's say everyday life of a teenager who may experience a sexual health problem, or understanding the mental part of it as well. So, AHEC probably, I would say it would go hand in hand, yeah.
Oh, that's fantastic. So my last question is: so someone walks up to you and says, "Hey, Charles, I'm interested in AHEC. What would you tell them about the program, or what would you pieces of advice you would give them?"
Um, my first advice I would give them, one, I would ask them, are they serious? Because nowadays a lot of people don't understand what this program can really offer for you in terms of it. Some people just see it as something you can add to your resume as a great curriculum. Oh, I did this time, but not understanding the fundamentals of it. Um, Two, I would recommend the program to anyone who's willing to get involved, who's not like who was me, like lost trying to find like most of a career path of it. Um, folks who want to get into the backgrounds of health officials. I'm sorry, it's been a long day.
Mhm.
Um, excuse me. Yeah, anyone who wants to get involved in health, anyone who wants to get involved in medicine, mental health, or just be an advocate for the program as well, I would recommend it. Yes.
Awesome. Thanks for that. Interviewing you allowed me and the audience to get another value experience through the lens of an AHEC student. So next up, Charles will be interviewing Dr. Watson in this segment.
And I
If
want
you,
to congratulate Charles before we, Alex, just stay
yeah,
encouraged, Charles. It's always good to see a young Black man pursuing healthcare. We need you. We need your face. We need your experience. It's just important for people who've had lived experiences to be able to share their lived experience on the provider end. Too often, I can't tell you, Charles, how many people I get that reach out to me to say, "Hey, Karriem, do you know a Black male physician, a Black male provider?" And a physician assistant will put you in that category of being a healthcare provider. And I look forward to one day being able to say, I know Charles Holloway. He's at X clinic. Please give him a call. He'll make sure you're okay. So blessings to you in your journey.
Thank you, sir. Thank you.
yeah. So like I said, feel free to stay on or ask some questions later on if you like. But right now, for the next part of the segment, we'll be having a discussion with Dr. Karriem Watson about precision medicine and the All of Us research program. So, good evening, Dr. Watson. I hope all things are well with you.
Things are great, Alex. Thank you for asking.
Yeah, no problem. So, precision medicine, the big
Yes,
thing we're talking about tonight. Can you give us a crash course on your understanding of what precision medicine is?
I can. And I have to think about when I think about the work that you all are doing with AHEC and through the young health professionals, I think about something that Dr. Linda Ray Murray said to me once. And she said, Karriem, all medicine should be precision medicine. And she's absolutely right. All medicine should be precision medicine. But unfortunately, in most cases, it's not. And what do we mean by precision medicine? I first like to break the word down into two components: precision and medicine, meaning medicine, healthcare that is precise for an individual. Meaning that when we think about an individual's healthcare journey, you think about disease and illness, there's many factors that go into play to create that environment for that particular patient or person. There could be genetics, but unfortunately, and in some cases, usually, Alex, and when you think about cancer, for example, only about 10% of cancers are actually what we call genetic, meaning that you inherit genes from a parent that will be passed on to you as a child that will go on to result in cancer. The inheritable traits, only less than 10% of cancers are what we call inheritable. What we have to think more about is epigenetics, meaning on top of the gene, the way our environment interacts with the genes we're born with, the way our environment can change or alter the genes that we're born with, the food that we eat, the stress that we're under, racism, the neighborhood you live in, the zip code. One of my mentors, Dr. Wynn, used to say that your ZNA is more important than your DNA. And what he meant by your ZNA was your zip code, where you live, oftentimes what food you have access to, your health literacy, and not necessarily how quote unquote smart you are, because that's not what health literacy is, but Do you have healthcare teams that can talk to you about your health, about your illness in a way that you understand, that you can communicate back to someone else? So precision medicine is understanding that we're all different. We are all individuals, but the way that we are impacted by our family history, the environments that we live in, the things that we're exposed to, the things that we eat. You know, you're a public health professional, you're an epidemiologist, Alex. You know those modifiable and non-modifiable risk factors. All those things come together when we talk about precision medicine.
Yeah, so that's definitely what we I've learned about in school about, you know, everything you mentioned, the social determinants of health, they all come into play when it comes to precision medicine and what that means for anyone that walks into a clinic.
Right.
Like you said, the cancers are, I was surprised. I didn't even know that, you know, only 10% of it is actually genetic. The rest of it is more so everything that you experience in life, like
Yeah.
from the TV you watch, the cell phones you listen to, you use, the food you eat, the things you experience. It's actually, that's actually really interesting that all that stuff is actually more impactful than what is on the inside. So it's more, sounds like it's more of a nurture, not nature versus nurture.
It's nurture versus nature.
Yeah, nurture versus nature type thing, but it's definitely more external than internal.
Yeah, like you think about it, like another mentor of mine will give this example. He would give an example of two twins. You could have these, say you have two sisters that are born, and this is an analogy he created, so I didn't make this up, so I want to give credit where credit is due. But you could have two sisters that are both born on the south side of Chicago, right? And they could be twins. So genetically, they're very similar. They both go away to college, but one goes to they could even go to the same college. But after they go away to college, they say they go to UIC. One decides that she wants to be a teacher and stay in a neighborhood on the south side. The other decides that she wants to go into law and moves to the East Coast, or moves to Lincoln Park. Let's say they both stay in Illinois, right? Well, the sister that lives in Lincoln Park may live in a neighborhood where she has access in walking distance to grocery stores where she can get fresh and organic produce. She has to think little about her safety and some concerns, whereas the other sister may be thinking about other things. She's a teacher, she's underpaid, right? We got to pay our teachers better. It's always give a plug to pay teachers better, right? But she's underpaid, she's overworked, right? And then she has to think about, and she's experiencing racism possibly and other things. So although they were born with a similar quote unquote genetic makeup, their life experiences, their lived experience, and their exposures can be so totally different, right? And so we think about when those two sisters come to the doctor, that doctor or that physician or that PA, like Charles will be one day, needs to ask those sisters different questions possibly, right? He may need to ask that sister who may be a teacher and dealing with all that students are dealing with COVID and the pandemic right now. He may need to ask her, what are you doing for mental health? Are you able to get any physical exercise and activity? What are you doing for your diet? Ask her questions that are tailored to her individual lived experience. And this, similar for the other sister.
Mm-hmm. Yeah, I agree. I think a lot of that stuff needs to be, I think that's the exciting part about research is you're able to, because everyone has different lived experiences and all that stuff, and you can develop research or, questionnaires to assess all of those different lived experiences. And you can create, well, that's, precision medicine, but creating questionnaires like based on lived experiences, you're at risk for this, or we have to look for this based on what you've already experienced, like based on your, the social determinants of health. So,
I'm sorry, go ahead.
No, please. What were you going to say?
The other thing about the piece I love about precision medicine, and then getting into what the All of Us research program is trying to do, it's also important that when we think about individuals, we think about data. And you kind of got into it. I know you love data, right? And when you think about data, though, as you well know, you could teach the class on this. Sometimes in order to ask the question to get the answer that can really say, is there a difference between group A and group B? You need that sample size to be large, right? Else you might not, or else you might not be able to say that what you see is truly due to some difference, but it may be some just random occurrence, right? Mm-hmm. So that's the other thing that has been impacting people like myself and others that do health disparities research. Particularly when you want to focus on health disparities with a group like African American or like in my case, want to work with African-American men. One of the things that we struggle with, Alex, is that people say, well, Karriem, your data sample only included 137 men. That's a small population, and you really can't, it's not what we call powered large enough to really be able to get at differences and nuances. So one of the things that the Precision Medicine, the All of Us research program is doing is setting out to collect data on 1 million or more people over a period of time, where researchers like you one day, the future Dr. Kimbrough, and others can ask questions from a database that is large. And as a result of that database being large and reflects the diversity of the US, it'll be one of the first times that we'll be able to ask research questions that can be powered based on the data. For example, we have over 400,000 participants in the All of Us research program enrolled to date. Our goal, we're almost at the halfway mark. So we're on an aggressive push over the next 5 years to get over 500,000 people enrolled. But we also are committed to diversity. 70% of those enrolled right now, 80% of those enrolled right now are what we call underrepresented in biomedical research. That means that includes racial ethnic minorities. They may be older than 65. They come from rural areas, or they may have rare diseases. They may have low socioeconomic status and low annual income. But the other piece of the data I'm proud of, Alex, is that 50% of our sample right now is racial and ethnic minorities. That is so important because people will be able to come to our database and say, I want to be able to look at people that live in these urban areas like Chicago, Detroit, Philly, St. Louis. I want to be able to look at these urban areas and look at Black men in these urban areas and see how many of these Black men over the age of 30 have elevated blood pressure, have hypertension, or pre-diabetes. And you'll be able to look at our data set and be able to ask questions like that because we have sample sizes that are large enough. And that's a powerful tool to have. So I'm really excited about the diversity, equity, and inclusion we're including in the data set, because too often we're not a part of research. We don't want to participate for understandable reasons, but it's not even more often, Alex, that we don't want to participate. We're not asked, or the research is not conducted in places where we go.
I agree. Working under you, it has been very interesting work going in the communities and learning about community-based participatory research. But it sounds like this plan, it's I wouldn't say it's revolution. It could be almost revolutionary as the Human Genome Project, where we're trying to.
It spins off from the Human Genome Project.
Oh, really? Can you talk about that a little bit? Because I know it sounds that you definitely led into it with precision medicine. So I knew it had to do with genes somewhere. And probably the biggest thing in the early 2000s was the Human Genome Project. So please.
Right. So you're absolutely right. So one of the things we're collecting is with genomic information and data. So when a participant enrolls in the All of Us research program, we collect both survey information. We ask you like your zip code, your address, where you live, so that we can get that information. Sorry. It's real life. And
right.
We ask you information about where you live. We then also collect information on biophysical information. We collect blood, urine, and/or saliva, and that's where we're able to get that genomic information. So we're getting ready to be able to sequence people's genome, where we can tell people who have enrolled in the study, who have given us consent to get what we call genetic return of results. We'll be able to return results back to them to say that based on our analysis, you may be at elevated risk for X, or you may be at elevated risk to be predisposed to Y. And, by that, returning that genetic information, that genomic information to people, that'll allow people to make different decisions. And we're not just going to return that information and say, okay, here you go, you're on your own. We'll be returning that information, making sure that these participants have access to genetic counselors, access to know what questions they should ask their physician. That information will be returned with the appropriate amount of guidance to those participants, because we can't just get information and expect for people to know what to do with it.
Oh yeah, for sure. Information is a powerful tool, and you need to know how to use that tool.
How to use it.
Yeah, you just can't give it to them. That's actually really that's fascinating. So, as in your position so far, whether it comes to All of Us and precision medicine, have you run into any misconceptions about it, or about from the public or everyone else about what this study or this research may be? Have you
all the time.
apprehension?
Oh my
I can
God.
imagine
Yeah.
because people be like, I don't know. Once you taking my genetic information, I don't know what you're gonna
That's
do
right.
with it. X, Y, Z. What have you
So
seen?
one of the biggest things I run into, particularly with people of color, and I don't want to say this in a judgmental way.
Mhm.
You should be skeptical when someone asks you, but being skeptical doesn't mean that your outcome is a no. Being skeptical is another word for saying being curious. And we give people of communities of color, sometimes we frame it inappropriately, because where other communities are just say that they're curious or they're being critical, we become medical, we become non-trusting, we become medical mistrust. No, we're critical too, and it's okay to be critical of a system that has not always been good to us. So what I get sometimes though is people not understand. I would say they have more of a misconception about what research is and what research is not, particularly when it comes to clinical trials. I tell people our program is not a clinical trial in the event that we're testing some new intervention. We're not looking to see if drug A or drug B works better. We're not looking to see if people who do X versus people who do Y have a better health outcome. Those are questions we hope that researchers will be able to ask from our database, but the All of Us research program is setting out to build a cohort of 1 million or more individuals where researchers one day like you can ask what questions they want to ask. So that's the first misconception that people have, Alex, is that our program, although it's a research program, they think that it's interventional. They think that we're trying to intervene in some way. They think that we're trying to test a new drug or test a new device or test some new procedure. We're not trying to do any of that. Now, researchers may come one day and use our data to be able to understand new interventions, new devices, and how they impact certain populations. But the All of Us research program is setting out to build a diverse cohort of 1 million or more people that reflect the rich diversity of the U.S. The other misconception that people have is, again, around research. They say stuff like, Karriem, I don't want to give the government my information. I hate to break it to you, but every time you use one of these, every time you go on the internet, every time you search, your information is pretty much is out there. I tell students, one of the students I was talking to, he said, I don't want the government to know my information. I said, can I ask you a personal question? Are you on financial aid? Well, yeah, I'm on financial aid. I said, the government already got your information.
Yeah, they got everything. Yep.
They got everything. They're gonna be following you for a while. I hate to break it to you.
Yep.
But I don't want to make light of that. But while we should definitely be protective of our information, we also have to understand that if our information is not a part of what's being analyzed, we need to question whether or not things are generalizable to us when they become broadly available. Although our program doesn't have anything to do with the development of the vaccines, as a health disparities researcher, I was happy when I looked at the diversity data to see that the manufacturers of the vaccine they were intentional, ensuring that racial and ethnic groups were enrolled in the vaccine development studies, because too often that has not been the case. If you think about cancer, Alex, less than 5% of African Americans who are dealing with cancer participate in cancer clinical trials. And that ain't all on them. Some of that is because the trial has not been designed in a way that we can participate. The inclusion and exclusion criteria don't fit us. They exclude us when they say you can't have high blood pressure, you can't have diabetes. You just excluded half the people I know with cancer.
Mm-hmm. All the comorbidities that we unfortunately lead in cause us to be, unable to be in the study, which
exactly
makes a huge issue. I really want to talk about, because I'm thinking about now with all this data that you have, 400,000 observations essentially. Who's on the staff to who makes up all of us when it comes to managing that data, collecting the data, or what does that look like for you guys?
That's a great question, Alex, and we need to always ask that question. When I give you, and I encourage the listeners and people in the community to ask that question. When I give you my data, do you have people that look like me, that live where I live, that had similar experience that I've had, that's handling and analyzing my data? Because even the analysis of data is not free of bias. We want it to be free of bias, but even AI, artificial intelligence, is not free of bias, because garbage in is garbage out, right? So the way, if you design the program with bias, it's going to be biased on the way the output data comes in. But I'll answer that question by saying the All of Us research program has been intentional, not only in the diversity, equity, inclusion that we're having with our participants, we're also intentional in ensuring that our research staff our workforce reflects the rich diversity as well. When I think about my engagement division, our engagement division looks like America. It looks like the diversity of America. And we think about, but are we perfect in that? We are not. We need to make sure that we're working with HBCUs, historically Black college universities. That's why I was happy to see Brother Charles on here from Alcorn. We need to, because whenever somebody tells me, Karriem, I can't find young, talented Black men, I say, you're not looking hard enough. I got in all of my research, Alex, you know this firsthand, I've always been able to engage a young Black man in doing my work because someone engaged me. When I was new to Chicago, Project Brotherhood opened their doors up to me and let me learn by mistake many times, but learn and grow. I got exposed to people that were literally national experts as a young Black graduate student, right? Where do you get that type of exposure? But what that exposure does to you is it prepares you for when you're at the NIH and when you're able to make those decisions. So to answer your question directly, what does the staff look like? We have to do more in the terms of diversity and inclusion, but I am happy to say that we partner with universities and community-based organizations, including federally qualified health centers across the US, to ensure that we have partners that are just as diverse as the data that we're collecting. But not only are we, Alex, ensuring that we have 1 million or more participants in the study, we are also ensuring that we have 10,000 or more researchers that are able to access and analyze our data. So we have a new 5-year goal for researcher engagement, where we want to make sure that at least 50% of those researchers are from underrepresented racial ethnic minority groups. Because if you go and look at the NIH pool of researchers that get those alphabet soup grants, the R01s, the U54s, those big grants, it's single-digit percentages of those researchers that are African American. And that should not be the case. And that's why I'm really happy for programs like the Area Health and Education Centers that are intentionally focusing on bringing education and awareness and opportunities to young people of color, so that they can know the importance of getting exposed to these careers early on, so they can be prepared and be ready to take advantage of those opportunities.
That's amazing stuff. I think also one of my other questions, this is more off the demographic side. So what kind of like positions may you have? Like, do you guys, I'm assuming you guys have people that deal with genomics and the other, like maybe data managers, quality managers, probably. Can you give us like maybe quite a few? I'm not really sure.
I'm always amazed. I'm kind of sometimes, I don't believe in ever going back, and I believe in being in the present, but I wish I could be like my 6th grade self and see what I see now, because I was happy to hear that Charles is interested in being a PA physician assistant. But Alex, the opportunities are endless. Today, I talked to a member of our team that's doing data analytics, right? She's going to be building up a database, helping us look at our database from a data analytics perspective. We have one member of our team that's an engineer. He thinks about how do you design our platform, right? So design our platform to be safe, that can house all that data, that can communicate across multiple health record systems. We have physicians on our team, people that have been geriatricians working with older populations that are also now researchers. We have biostatisticians, epidemiologists, social epidemiologists. I love when I work with social epidemiologists, anthropologists, people that look at cultural anthropology and the study of human behavior. We also have health communications experts, public policy analysts, and even attorneys. I shout out to Andre, our budding public health attorney, because we have an attorney on our team. And I will admit, I love when I get a chance to talk to one of our policy directors, she's an attorney, because I can ask her, I can say, in your experience in this, she's actually a PhD in public policy, but we have other attorneys as well. And I can talk to her and say, what's the policy issue here? I'm thinking about this from, making sure that Asian languages are people that speak the top 5 Asian languages are able to be enrolled in our program. But what's the policy issue here? Alex, we have people that are experts in tribal engagement, looking at working with American Indian, Alaska Native populations, right? That have expertise in that area. So I've just been amazed. And sometimes I wish I could bring young people on board and say, just look at all the things that you can do and you can be. I no longer like to ask young people what do they want to do when they grow up. I like to ask you, what issue do you see yourself being a part of solving? What part of the solution do you see yourself, what role in the solution do you see yourself playing? And then work your way backwards and say, now what preparation do I need to have to be a part of that solution?
That's a wonderful question. I think I wish I had that question asked when I was younger. I got the, what do you want to be when you grow up? And I went the other way. But I think that's a brilliant thing to ask. And I love the diversity. Like, I would never, like, when I was in college, I had a passion for anthropology for like 5 minutes. And so seeing that there's anthropologists on your team, engineers, another degree that I was thinking about being a part of, like, it's open to anybody, and all this falls under, which is really cool part, is all this falls under public health.
Right.
Public health engineer, public
journalists.
Health
We have journalists. We have former news reporters that are on our team, Alex, because the way you communicate this information to the public, we've seen that with COVID-19, right?
Yes.
Messaging matters. And not only does messaging matters, the messenger matters too, right?
Yep.
And so I'm really, really excited about, like, the former CEO, the original inaugural CEO of the program, had a background in information technology and IT and developing large systems. So I'm just amazed, and I'm excited for young people because you all have so many opportunities to think about public health in a much broader sense than what I thought about public health when I was a graduate or undergraduate student.
Yeah, I mean, so when I was undergrad, if I knew this is what public health was, I would have kind of went away from medicine a little bit more to this is amazing. Like, this is crazy. I could do anything and everything for the public. So so what about, like, so I know you guys are doing a lot, like I said, a lot of research, collecting a lot of data now. Is there anything being researched now with the data, or what's
we've had some early wins, and if someone wants to learn more about the program, they can go to allofus.nih.gov, or they can go to joinallofus.org and learn more about the program. But one of the things that was really been in the news about our program is that recently we were able to, because of our data and because we had biospecimens, we were able to then run those biospecimens and see, did we have participants in our program that have been exposed to COVID-19? And because of our large database, we were actually able to show that the COVID-19, the SARS-CoV-2 virus, was actually in the US earlier than what we thought. And we were able to demonstrate that because we had the large data set and the biospecimens that we could analyze. Another thing we analyzed during the COVID-19 pandemic was we sent out a survey that was called COPE, looking at the COVID-19 pandemic and the social determinants of health. And we were able to determine that many people are dealing with mental health challenges and other challenges. And so we were able to take that data to other researchers and say, as you develop interventions, do not forget about the mental health issues that people impacted by COVID-19 are experiencing. And we've even had one researcher looking up glaucoma. She's been doing ophthalmology research for a while, but because some diseases in ophthalmology are not rare, but you have to have a large sample size to really understand interactions and everything.
Right.
Well, because of our large sample size, she was able to understand better the impact of medication adherence to the progression of glaucoma and blindness in African Americans.
Wow.
And so when she told me about that study and she got that data from our All of Us data set, I was excited because I said researchers can access this data and ask questions that we've never been able to ask before. Gone are the days when someone can say, well, Karriem, I'm not able to get access to 400 Black men that are tobacco users across the US. I'm saying, yes, you are. You can go to the All of Us research data set and see if you can find that number. So I'm excited. And I don't want to present it like, we don't have our challenges, that we don't have our biases to get over. We do. But I will say that the program has truly been committed to doing things differently. And when you get committed to doing things differently, you kind of got to take the bumps and go with it and really be committed to ensuring that if you say you want to have the most diverse data set in the country, then that's going to come with some intentionality around diversity, equity, and inclusion.
Wow, that is, I mean, background epidemiology, you had me at the fact that you could track genetically that COVID was here earlier than expected. I was just thinking
I'll
about
send you
all
the
the
paper. I
studies.
know you want the evidence. I'll send
Right.
you
I was like, wow, that's amazing, and more epi, please. But yeah, so that actually goes into my another question is that so it sounds like you're obviously really excited about everything that all of us is doing. You believe in it wholeheartedly. So what is that one kernel of things that gets you up in the morning ready to go and take on today's challenges at all of us?
and I'll reframe that and say what keeps me up at night too. What keeps me up at night is the digital divide. As much as I love the program, a lot of it is still dependent on the fact of you having access to the internet, or you having access to your electronic health records, or you having access to a site that is actually enrolling for the study, right? That's kind of what keeps me up at night, because I think another thing that keeps me up at night is the decisions that people have to make, not knowing that sometimes people feel that it's a or and not an and. And what I mean by that, we have millions of Americans right now that are impacted by COVID-19, whether they're dealing with it themselves, dealing with a loved one, or we're not even talking about the people that are dealing with loss and grief from it, right?
Mm-hmm.
And when you approach these, or you got teachers, think about teachers right now. Teachers are really top of mind for me, right?
Yeah.
Right now, you think about teachers, thinking about, especially teachers who are also parents. They're like, I got to teach the kids and raise the kids.
Oh.
The school closed, daycare's closed. And I got to try to teach Zoom, right?
Yeah.
So imagine what they're going through. Then here come Karriem. Hey, sign up for the All of Us research program. They're looking at me with their left eye like, what are you talking about? I'm trying to just get through this pandemic. And you talking about sign up for this research program. And so that's another thing, is that how do we prioritize, ensuring that people stay up to date with this, not just research, but how do we prioritize the continuation of healthcare amidst this pandemic? Because you still got to get your screenings. You still got to get your colonoscopies. You still got to get your mammograms, right? You still got to go get your asthma medication. You still have to do all these things. And you still have to participate in research, because we still have to ask these questions. But people feel, unfortunately, like they have to make an or decision. I either do this or I do that. I either participate in research or I don't. No, we have to try to get to a place where it's the and, where we let people know the importance of having your data at the table, right? Some people say, if you're not at the table, you're on the menu. I take it even further. I don't even want to be at the table. I don't want to have a seat at the table. I want to go grocery shopping with you. I want to determine what the menu going to be. I want to determine the grocery list so that I can make sure you're cooking something that I even want, that's going to be healthy for me, that's going to taste good to me. And so that's one thing that keeps me up at night, thinking about those populations that don't have access to the internet still, thinking about those populations that don't have that smartphone where they can log into their health information. We're collecting information through wearable devices, Alex, where we got Fitbit information, wearable information. That's amazing, right? But who has access to a wearable? It's a small subset of the population that actually has time and resources to be thinking about, what are my steps, right?
Yep.
I can't be thinking about what my steps when I'm trying to drop off the kids, pick up some food, pay the bills, and not get COVID. Right? I don't have time to think about my steps.
No, not at all. It's the last thing on your mind.
And then I might be worried about what my steps might be saying, or what my sleep habits might look like on this smartwatch, because I'm like, kind of sometimes out of sight is out of mind, right? If I don't know, I think I'm sleeping 8 hours, but then my watch is telling me you slept 8 hours, but only 4.8 of that 8 hours was restful sleep.
Right.
Now I'm stressed, I'm not getting enough sleep.
Yeah, and that's another stressor.
That's another stressor. So I say all that to say those are things that keep me up at night. And as a program, what I try to do is push us to continue to design the program that it truly is for all of us. One of the things that makes me worry sometimes is that research, not just our program, but that research is for some of us and not all of us. So what keeps me up at night is I ask my team and my colleagues the question on a regular basis. All right, these are the people that got to us, but what about the people that couldn't get to us? What prevents them from getting to us? I want the naysayers. I want people that say that they're not interested to tell me why they're not interested, because then that's who I want to hear from, because I want to hear, what don't you hear in this message that is important? Because I think it's important, but why don't you think it's important? What am I missing about your priorities that are not aligned with our priorities?
Yeah, that's really important. I think it's reaching everybody, and those are really important topics. The digital divide, like that's huge. I
Yeah.
remember doing working under you doing research in my graduate program, learning about digital divide. I had never thought about the fact that some places people one don't even know how to use the phone or may not even have access to internet. Those are things that we think that some of us, people who are more privileged, take that as for granted. And we
Yeah.
forget that there are rural areas where there is no internet, let alone any running water.
Or
So,
a large apartment here. You've done international research before. You've been abroad, Alex. It was a eye-opening experience for me when I was doing some research and some work in Haiti, and I went to turn. I was brushing my teeth, something as simple as brushing my teeth, and you have to remind yourself that you can't necessarily drink the water from the fountain when you're
yep.
brushing your teeth from the faucet. That you had to go get the water that's been treated with the chlorine tablets and everything else
Mhm.
that's been made, that's been purified to make it safe for treatment, right? Something as
Mhm.
simple as a basic necessity of life, water, was not available to most of the people that I worked with in this rural village in Haiti, right? And
Mhm.
you felt bad because I was in there for a week-long program collecting data, but then I got to leave and come home to my purified and bottled
Yeah,
water,
yeah,
right?
yep, yep.
And you think of, and one day we were we were walking up the mountains going to do a home visit with community health workers in
Mhm.
rural Haiti. And I'm walking up, I got my backpack, I got my snacks, and I get thirsty. I pull out my water bottle, pull out my little snacks. And one of the Haitian doctors looking at me like, "What are you doing? You pulling out a bottle of water and your little snacks from the store? That's dinner for them, right?
Wow.
And the bottled water, are you serious right now? You pulling out a bottle of water in a rural
Yeah.
village in Haiti? Are you serious right now?" And I was like, "My bad," and I put,
Right. Whoops.
but I was like, I don't really get to think of myself as privileged often, so this is new for me,
Right.
right?
Yeah.
But you go abroad, you will see the privilege that we have. But even the brother earlier talked about, the fact that we have to think about some of our youth that are in dorms. They might be on a smaller campus. That smaller campus may not have the broadband access that some of our larger campuses have, right?
Mhm.
You might live in an apartment complex where if there's multiple people online at 5 o'clock or 3 o'clock, your internet might be real slow, especially with kids being homeschooled right now, or people quarantining, or more people working from home. That
Mhm.
all that impacts who's able to enroll in our program. And that's what keeps me up at night, or that's what keeps me thinking about how do we make this more equitable.
Yeah. So the last thing I want to ask you is, so for anyone that wants to get involved with, precision medicine, or even sees himself in the future of working in the big all of us, it's going to be the big thing that all of us is going to be in the next. I feel like it's going to be big in the next, even now, but even in the future. What advice can you give to students out there, or early career professionals, or anyone that wants to take that leap or that change to work in precision medicine, or even, you know, doing something, working with all of us?
Find your niche and find your passion. So I would tell a young person, interested in public health career, or any career in healthcare, do the landscape analysis. And what I mean by that is look out and see what are the challenges that America is facing right now. You think about our environment, Alex. We haven't even begun to touch the surface about the environmental health advocates that are going to be needed. The lawyers, the public health lawyers are going to be needed to deal with these issues of environmental racism, right? These land dumps, these toxic waste dumps that are more often in Black and brown communities, and the impact that will have on the respiratory health and the lung health of our children and our adults growing up, right? We don't have enough professionals in respiratory health. We know all the respiratory illnesses that we're going to see in the future. We don't have enough professionals in respiratory health, right? From the tech, the radiologist reading the scans, to the person inventing the device for the new treatment for that inhaler. We need all of those in respiratory health. So look out and see what you're passionate about. If you're passionate about photography, I don't know if you've seen this new LinkedIn. It's on LinkedIn, but it's been making its way across the internet. A young Black medical student who does medical illustrations
Mhm.
has done medical illustrations showing that are of people of color.
I did see
And,
that. Yeah.
and I remember in taking a medical school course, a graduate course in anatomy, Alex, and looking through those books, and all the images were non-Black images. And if they
Mhm.
were of people of color, they were on the lighter spectrum, right? So when I go to the dermatologist and a doctor looks at my skin, if they've never seen my skin and they're learning in through their dermatology courses and they're practicing, I become the practice. I become the study, because you never look to see what psoriasis may look like in a darker complexion versus what psoriasis looks like in a white American. It looks different, right? And so you don't want to be surprised the first time you see that Black patient. So if I say all that to say that if you are passionate about art and drawing and public health, we need you. We need you in medical illustrations. We need you in photography. We need you to be able to take pictures of things, to be able to explain some of the things that we see and illustrate those things, right? I love when art and health, when they come together and they marry each other, right? And so that's what I would tell a young person. Find out what you're passionate about. And if you're passionate about something in public health or healthcare, don't be afraid of saying, I don't see exactly what I want to do, but I know if I get prepared and I get the preparation I need, I might be able to open write my own ticket, right? Because you very rarely hear a young person say, I want to be a medical illustrator when I grow up. But they fall into it. I didn't know anything about clinical trials, Alex. I got through clinical trials through failure because I had failed a lot. I had failed in some courses. I had failed in attempts in some programs. And because I had failed in those areas, I needed to say, okay, I have this training. What do I do with it now? And someone introduced me to clinical research. I didn't get introduced to clinical research through saying that that's what I want to do when I grow up. I got introduced to that through failure. And I got introduced to that failure because I tried. I said, put me in, coach. I threw my hat in the ring. And what looked like a failure ended up turning into the best navigation routes I could ever thought about. I couldn't have dreamed of this. I'm exceeding my dreams when I think about what I'm doing on a daily basis.
So inspiring. That's really amazing. That really, that inspires me, and I'm sure it's going to inspire anyone that's in the audience listening to this podcast.
I hope so. The failure, and we as older people, I'm in the older person squad now. we got to be able to tell people about our failures. We don't talk about our failures nearly enough, right? And I have failed so much. It's ridiculous. If you want to talk about failing some standardized tests, give me a call, send me an email. I really failed it.
Right. Sit there, pull up a chair, and talk.
That's right. But I didn't let those failures define me. I remember talking to Dr. Wynn one day, and he asked me, he said, don't believe what they say about you. Believe what your ancestors have said about you, and believe what you know about yourself. Because in my head, I knew I was capable of doing it, but I didn't. But comparing myself to those Eurocentric views of success, those versions of intelligence that weren't measured or designed to measure the complete person, I felt like a failure in some regards. But then when I began to step outside of that narrow definition of what success was, and I did that pivot, that's when the world opened up.
Wow. More stuff to think about. Thank you so much tonight, Dr. Watson, for giving us these gems of information, as well as talking about precision medicine in the All of Us study.
Yes, I got to drop it because that's what we do. So allofus.nih.gov or joinallofus.org. Please go and look it up. And if you have questions, please contact the Young Health Professionals, YHP. They know how to reach me. I love talking to young people about this journey of mine in research and precision medicine.
Yep, you hear it first. You hear it from the horse's mouth himself. All right, everyone. That concludes our podcast tonight. Stay safe and have a great night.
All right. Thank you.